the Kingston Economic Development Corporation. I'd like to express a thank you to all the businesses and community partners who've taken the time to join us today. We hope that today's session provides some clarity as you look to your own individual reopening procedures for your businesses when scheduled to do so. I'd like to extend a special thank you to the KFL&A public health representatives who will be leading much of the discussion today. So today from KFL&A Public Health, we've got Sarah Riding joining us. She's the manager of environmental health team. We have Miranda Iezzi joining us, who's the public health inspector and an environmental health facilitator with the environmental health team, as well as Cindy Lee, who's a public health inspector and enforcement lead for the environmental health team. Upon completion of today's presentation, Megan Knott and her team at Tourism Kingston will lead the Q&A portion of the session. Please note that all questions will be facilitated through the Zoom chat function and then will be triaged to the public health team accordingly. If anyone has additional questions that may not have been answered through today's discussion, please direct them on through your business community partners or through an appointed public health representative. Lastly, please note that today's session has been developed based on conditions and information available as of today, May 21st, 2020, and that information, procedures, and recommendations may be amended as the current recovery system shifts in the future. At this point, I'm going to hand the control of the session over to the Tourism Kingston team to begin the presentation. So thanks again for joining in and enjoy.
Unmute Miranda. Yes, where is she? I don't know. Thanks, Ian. Can everybody hear me okay? Just maybe give me a thumbs up. Awesome. So essentially how we're going to run this is I'll disappear and we're going to show or screen share some PowerPoints created by Miranda from KFL&A. So I want to thank Miranda in advance for all her time and hard work and heavy lifting as it relates to putting these PowerPoints together, because I find that it's going to be very useful. So Brittany's going to help me put these PowerPoints up and
start again. I just want to thank everyone for having us, and we're glad that we can be of some assistance today. This is just a very brief presentation with some general information for guidance in reopening your businesses. In no way is this all encompassing with all the information out there. It's just narrowed the most common and basic information that relates to all sectors. I've also set up the presentation to work as a guidance document that we can provide to you with hyperlinks throughout that is easy to navigate. Next slide, please. Next slide, please. Thank you. So today we'll talk briefly about the current situation in legislation, summary of current public health recommendations. We'll have a slide with links to very useful and relevant documents, and then we'll have time at the end for questions. I do have a couple questions that I was given in advance. I will answer those first, and then I will open it up for everyone else to ask some questions. So disclaimer, so this is really important. Ian had already mentioned it. This presentation is based on information available as of May 20th, 2020. So I had to make this presentation yesterday, so it's not updated to today's date, but that's okay. The COVID-19 situation and information is ever changing, so please ensure that you are keeping up to date with the current best practices. Just because I've said something today does not mean it's not going to change tomorrow. So it's really important that you keep up to date with all the new information that's coming out. And the last thing is KFL&A Public Health cannot provide occupational health and safety advice. For example, work refusals. Any of these types of inquiries should go to the Ministry of Labor. Next slide, please. So this is just a summary of the progression of public health measures in Ontario. As you can see, on March 23rd is the day when non-essential workplaces were closed. So it has been a long and tough time for everyone. Next slide, please. So on March 11th, 2020, the World Health Organization declared a global pandemic. The current status of cases in KFL&A is 62 cases, with only one being active. There currently is not a high rate of transmission of COVID-19 within KFL&A. Next slide, please. Legislation. So there's currently only two main pieces of legislation that have been enacted: the Federal Quarantine Act and the Emergency Management Protection Act. Under these acts, orders and regulations are made. KFL&A municipalities made a local state of emergency declaration on March 26, 2020. Next slide, please. The Quarantine Act. So this act is most well known for the power of the federal health minister to quarantine people who have traveled outside the country. But this also allows the federal health minister to screen travelers entering and exiting Canada, set up quarantine zones, fine or jail travelers who refuse to comply with instructions or quarantine officers, and they can make regulations under the act which take immediate effect. And again, one of the orders is the mandatory isolation order. Next slide, please. The Emergency Management and Civil Protection Act. The Ontario government declared an emergency under the EMPCA on March 17th, 2020. This emergency declaration has been extended several times, but the current end date is June 2nd, 2020. Under the EMCPA, there's currently been 40 orders that have been issued under this act. Next slide, please. So this slide just shows part of the amount of orders. And then if you can go to the next slide, please. This is the rest of the orders. So here I've highlighted the 4 orders that may be the most prevalent to businesses. I am not going to go through each of them, as that would probably take me an hour to do so in itself. They mostly outline who and who cannot operate. But if you can go to the next slide, please. I have taken the only portion of the closure of places of non-essential businesses that speaks to how businesses should operate. The first point is operate in accordance with all laws, including the Occupational Health and Safety Act. The second point is to operate in compliance with advice and recommendations of public health officials. And the final point is to try to restrict public access to the fullest extent by providing alternate methods of sale. Next slide, please. Transmission. So COVID-19 can spread person to person through respiratory droplets in 2 ways. The first way is close unprotected contact with an infected person. Worldwide, this is how majority of the cases are transmitted. So when reopening a business, these are the public health measures that can really greatly reduce spread. These measures can include policies and procedures limiting in-person interaction, physical distancing and physical barriers, cloth masks when physical distancing can be a challenge. The second potential route is touching, back the slide, please. Thanks. The second potential route is touching contaminated surfaces, then touching your mouth, eyes, or nose. There is no data on how much transmission actually occurs this way, but it is thought to be of low risk. This risk does increase, however, if you are living with or caring for someone who has COVID-19. Transmission via surfaces can be reduced by cleaning and disinfecting, not touching face, mouth, eyes, or nose, and washing hands. Next slide, please. So now we're on to a very brief summary of public health recommendations. Screening. If you prevent ill staff and customers from entering the workplace, you have prevented spread in a huge way. You can screen staff before each shift by a paper or electronic questionnaire, or having someone verbally ask the questions. Exclude staff who are ill and advise them to complete the ministry online assessment, or call primary care provider, or go to a community assessment center. It is important to have policies in place for reporting illnesses and also for when ill staff can return to work. You can also screen customers by placing signs at entrances stating "do not enter" if they have symptoms. Tracking your workforce. Please ensure that you have up-to-date contact information and schedules of your staff. This is extremely important if, heaven forbid, there's a positive case in the workplace. This information is imperative for our contact tracing team to decrease transmission within our community. Next slide, please. Improving policies and procedures to limit in-person contact. If there is no contact, then there is no risk. So these policies are ideal for maintaining longer-term solutions. Allow staff to work from home where possible. Eliminate or minimize non-essential tasks. Consider job rotation or shifts to minimize staff interacting with each other. For the same reason, stagger breaks and lunches. Consider curbside delivery and pickup. providing access to business only by appointment. This will limit how many customers and the type of interaction that occurs within the workplace. Virtual or phone interactions are ideal, especially things like prepaying over the phone. Designate workspaces and desks to staff members. It is very important to have COVID-19 policies. It is also equally as important to ensure that these policies are communicated to the staff. Next slide, please. There are many types of controls that can be put into place. Physical distancing is one of them. Employees should maintain 2 meters physical distance from other staff and customers, including during breaks and lunches. Consider floor markings to show the flow of people and distance to be kept apart. Post physical distancing signs at entrances and by cashier or service counters. Limit the number of customers in the business to allow for ease of movement while staying 6 feet apart. The province has provided an example recommendation of 1 customer per 4 square meters per 43 square feet, but it is just an example and it is not a mandatory formula. Next slide, please. Engineering controls. It is recommended where possible to institute engineering controls, which are also ideal for longer-term solutions, such as physical barriers to prevent close contact between staff and customers, use tap features at checkout instead of cash, improve fresh air intake or air circulation where possible. This is particularly important for small workplaces or office spaces where people are spending long hours of the day with each other. Next slide, please. Hand hygiene. Ensure all employees are informed of when and how to perform hand hygiene. Ensure all employees are informed of sneeze and cough etiquette. Common areas should have soap, hand sanitizer, or disinfectant wipes. Hand sanitizer, if available for customers, should be at entrances and exits. Post hand hygiene instructions around the workplace, and alcohol-based hand sanitizers should be a minimum of 60% alcohol content. Next slide, please. Cleaning and disinfection. Ensure frequent cleaning and disinfecting of high-touch surfaces in common areas. Some examples are listed here. It is also ideal to clean surfaces in between each client transaction if possible. Environmental cleaning should occur at least 2 times a day or as necessary. Disinfect shared desks, tools, and equipment between change of staff. Use only disinfectants that have a drug identification number. Health Canada has a list of all these products. Follow manufacturer instructions like contact time and ensure to check the expiry dates. Next slide, please. Cloth masks and face coverings. There's currently no requirement or directive for cloth masks or face coverings to be used for the general public in Ontario. It is extremely important that medical grade PPE not be used, as this needs to be reserved for healthcare settings and other specific scenarios. It is, however, recommended that non-medical face coverings be worn where physical distancing is a challenge. Cloth masks, gloves, and goggles are only effective if they are worn correctly. This is an important point. If masks cause people to touch their face more frequently, this increases risk of transmission, as well as improper glove use with no hand washing or changing of gloves when required. Which leads to the next point, that if these items will be worn, training must be conducted for things like taking on and taking off, as well as the limitations of the equipment. Next slide, please. And here's just the list of current and relevant guidance documents for everyone that you can use. The Government of Ontario has a huge collection of guidance documents for over 30 sectors. They also have a PPE supplier directory to help businesses locate things like eye protection and hand sanitizer. Public Health has updated resources and documents as well, and we are currently developing a policy template for workplaces that will be made available to you. There's also a dedicated phone line and email to help you with your infection control questions, which is on this screen. Next slide, please. So we'll go to questions, but I just wanted to address 2 questions that I had received prior. It was about outdoor eating options, what it might look like, how far apart should people be, is cleaning required between customers? We don't know what this will look like yet, as we are still in phase 1 of the reopening, but physical distancing will be in place for at least the imminent future. And so the amount apart would be 2 meters. Is cleaning required between customers? Yes. This could generate more droplets, this type of activity, because there is eating involved, as well as they're spending a longer amount of time in the same space. Another question was room turnover, protocol for cleaning, and time between customers and cleaners for hotel areas. For this, it would be the same type of protocols that you currently have in place. There is no need to change anything. Cleaners would have their own personal protective equipment that they would be required from their Occupational Health and Safety Committee. They can talk to their Occupational Health and Safety Committee if they do have further questions or concerns. But just things like not shaking laundry, maybe increasing ventilation in the room while they're in there cleaning are all helpful tips. And I can open it up now to questions.
All right, maybe I'll start triaging through some of these to help out here. Just rolling through some of the questions here. I believe these slides will be available through KFL&A website, so that's great. So a question here from Abba, with respect to personal care system, one of the many challenges is that different modalities for RMT or chiropractor versus spa are all putting out different guidelines, which is obviously very frustrating. So the question here is for range, having to change masks, et cetera, for each client. So maybe, I guess, what is it that should be rule of thumb for personal care systems with respect to the varying applications, whether it's RMT or chiropractic or spa?
So sorry, Ian, it's Sarah here, everybody. There was a little bit of cutting in and out there. So we got some of the questions. I believe it was about masking and in between clients, is that correct?
Specific to more of the personal care systems with RMTs or chiropractors and
Sorry, Tim, or Ian, you're frozen up on us right now. I apologize. I guess I'm gonna just wait for a minute if that's okay. We'll see if we can sort out the IT issues and help address some of these questions. Apologies.
Yes, hopefully I'm coming through, Sarah. It's a question directly for personal care services like RMT, chiropractors, or spa scenarios and protection.
Okay, so what I would suggest is for any of those particular questions, as Miranda had mentioned in the presentation, that we do have a dedicated phone line and we have a dedicated email address that we would like for sector-specific questions related to infection prevention and control, unique to their scenario, to direct those questions to those two options in order to have either a public health inspector or a public health nurse address those questions specifically. So that would be a perfect opportunity to ask those types of questions, because then the individual, we can get into a bit more of the details about the type of work that the individual is providing. There is guidance, again, ministry does have some sector specific advice about various infection prevention and control measures related to various jobs that people are performing. So those are also really good sources of information too. So without getting into the nitty gritty, I would suggest, I mean, I'm going to turn it back to these guys too to see if they have anything further, but I would suggest our email address was listed and our contact information was listed, but it's IPAC, so IPAC at KFLAPH.ca, or calling the health unit's phone number 613-549-1232, and then pushing the number 6 will get you through to a live body to be able to ask these questions to. I'm going to also turn it over to these guys to see if they have anything else to add.
So the other thing too is that if you're asking questions about like RMTs and chiropractors, those are regulated health professionals, so they should be getting guidance from their actual colleges, because they will be setting standards for those specific professions.
Awesome, thank you. Can you guys hear me now?
Yes.
I think every technical glitch that could have happened under the sun happened today, so I apologize. The second question is, if we were allowing a limited number of customers in an area like a store, should we be creating a contact list in case a breakout happens?
No, that's not necessary. And that's why we have our contact tracing team. They will speak with that individual who is COVID positive, and they will determine whether, who, and what is a contact. And being a contact doesn't mean you've just walked by them or stood in line for 5 minutes. There actually is a definition that goes with that, and there's a time frame that they need to meet. So that is not necessary.
So we have some owners in the area that own specific accommodations, and they're wondering, should they be safely promoting a tourism season for the summer? Understanding you might not be able to answer that question in full, but what advice would you have?
I think at this point, what we are promoting is stay apart, stay local, and stay safe. So if they can promote something that can promote those 3 things, we would be fine with it, but we really don't want people coming into our community because that's where a lot of our transmission comes from at this point. Doesn't mean they can't, but we're trying to really limit that for sure.
The other thing I just want to add, oh, you don't need to show me. The other thing is that currently the regulations don't allow for fun things, basically. You are allowed to have people over if you have a hotel, motel, that sort of thing, in terms of providing accommodations. But at this time, everything that is affiliated with the hotel or the motel in terms of like swimming pools and shared areas are still not permitted to operate at this time.
Thank you. So the next question comes from a funding, it's a funding question. So do you have any supports or recommendations for people as it relates to the purchase of PPE? Like, are you recommending different providers, or do you have content that you'd like to share with everyone on this call? And to be clear, there's over 300 people collectively on this call in some channel. So there's a lot of, a lot of people that are interested.
Sure. So I would say, I think Miranda did touch on this in her presentation too, that any of the personal protective measures that are purchased should abide by the standards. So there are requirements in terms of drug identification numbers, and Health Canada has a list of approved suppliers and manufacturers that would be meeting those requirements. So we would suggest, buying those types of products to ensure that you're getting the best quality product to be able to effectively address the risk. But we ourselves do not have, we at the Health Unit don't have a source of PPE to be able to supply our community with. So it would be, something that the individual business owners would have to investigate on their own. But again, just ensuring that if they are investing in these items, that they do meet the standards that should be met for their usage. So for things like disinfectants, you want to make sure that it's a proper concentration, same as your hand sanitizers, masks, if they are needed, the medical versus non-medical, just ensuring that those types of qualifiers are being, looked at before purchasing, just considered.
Just one other thing to add is on the presentation, there is a link for a PPE supply list.
Perfect. On
the ministry website, and they have provided everyone with links for things like masks, gowns, hand sanitizers, and you click on those, there's a list of businesses throughout Ontario that can to supply you with those things. So I'd say start on the ministry website with that link, see what you need and contact those businesses because they know there's an issue with trying to allocate and locate those types of things. So that's why they've created that website to help them with that.
Perfect. Thank you. So the next question, how many guests are permitted to seat together or sit together, I guess, rather, in a restaurant setting, knowing that patios are to come? And do we have to ask them if they're part of the same family unit or household?
None.
That's going to be something that we're going to have to wait on from the province because we are following what the province is telling us at this time. Right now, they haven't given any indication about what restaurants can do and when they are going to be allowed to open up back to the public. There have been hints in news releases about patios being the first thing to open up, but we really can't confirm anything until the regulations have changed to allow for all of that.
Thank you. So cottages are coming online, obviously, within Ontario. So understanding, is there a timeline or a recommendation in which people who own the cottage, who are renting to consumers, that they have to have downtime in terms of making sure that the cottage is safe before they offer it to the next rental person?
They should just be clean and disinfected in between each client or customer, basically. Not necessarily downtime, but opening windows and things like that is definitely something that can help. And so Cindy just said something.
I just pulled it up on the regulation. There is a section under regulation 8220, which is the regulation that allows for what is allowed to be open at this time. There is a section that speaks to short-term rentals. So if it's owners that are renting out to consumers, you're not actually supposed to, or you're not allowed to provide short-term rentals in rental accommodations unless it's for people who are in need of housing during the emergency period. But that does not apply if you are an actual hotel, motel, or student residence. So things like Airbnb for fun are out right now.
Okay. Obviously, we're close to the American border. Once it reopens, understanding that's a federal portion of information that'll come to us. Currently, if we have US customers that have booked at our resort or our campground or our hotels, are we required, based upon the knowledge we do know, to cancel their reservations? Additionally to that, once the US border opens, what do we do? Answer as best you can.
So no travelers are allowed into Canada unless their primary residence is in Canada. So if their primary residence is that cottage or rental unit, then yes, they are allowed to come and go to that, but they do have to quarantine for 14 days. And as for that, that's at this point all that's allowed.
I think the decision about whether or not to reimburse or to notify would be an individual business's decision to make, but would seem like good business sense to reach out to let them know.
Excellent. So once we get a sense of what reopening for restaurants and bars look like, if there is a bar at a particular establishment, what's that look like in terms of opening that restaurant and opening that specific portion of the restaurant?
So until that actually happens, we don't know for sure, but my assumption is it's going to be similar to what's the reopening that's occurred thus far with other sectors. And so if the question is getting at whether or not there would need to be, say, an opening inspection or something like that, as far as I know, that wouldn't be an expectation. We would wait for the word from the ministry, and if they give the green light to go ahead and operate, then as long as the businesses can read and interpret and identify themselves under those requirements, then they can go ahead and reopen. Again, we are able to address any particular questions related to that opening process. So again, any of those questions related to reopening. That would be about things like disinfectants or social distancing or masks versus face coverings, things like that. We can provide that guidance specifically. But if I were to guess, I'm going to guess that there would just be the same as the rest of the sectors, where one day they're allowed to operate and you would just go ahead and open the doors as long as it's being done as per the requirements of the regulation, those various public health protocols.
I just wanted just one more comment. If you think back to my slide about transmission, those things are always going to have to be in place until there's herd immunity or a vaccination. So how is it transmitted? Person-to-person contact, unprotected, or surfaces that are contaminated? How do we prevent those things? How do we stop those chains of transmission? Physical barriers, physical distancing, masks if necessary, cleaning, disinfecting, washing hands, don't touch your face. Those things are never, ever going to change. And those things are all going to have to be in place for any business that is going to need to reopen before a vaccine or herd immunity is done with. So.
Correct. So so there's more questions as it relates to bars specifically. So if a company has an actual bar, is it understood that plexiglass has to be a barrier between the bartender and those standing 6 feet apart at the bar?
No, it does not have to be plexiglass. You do not have to install physical barriers, but you do have to maintain 2 meters of distance. This is going to be a long-term thing. It's probably a good investment to put in those physical barriers, so you don't have to worry about being within the 2 meters or having to wear any face coverings or anything. This will be a long-term thing. So investing in those types of barriers, I don't think is a bad idea if it's something that's feasible and possible and will work for that work environment.
Thank you.
Just add one more thing too, because all these questions here, they're kind of like in a hypothetical situation because we don't know what the government's going to tell us in terms of what their expectation is when restaurants are going to be allowed to reopen back up. But if you go to the guidance, is the guidance slide that you had, one of the last few slides, there is that one link for sector specific guidance documents. As the government has been allowing places to reopen, they have been updating that website, and it is sector specific. So there will be information there that relates to restaurants and how they will, I expect that they'll update the existing one, because right now the existing one speaks to just how the workers are able to work in there safely, as we are only allowing delivery and takeout. But as that changes, they'll probably be updating that guidance document as well.
Fantastic, thank you. For non-essential businesses that have not obviously been allowed to reopen at this stage, what's the protocol or advice for what we can and can't do in terms of bringing people back to work, i.e., lots of us work in attractions, museums, other type settings where we are not open to public, but we're looking at bringing back staff so that we can do types of maintenance portions or updates, things to do with artifacts, sort of getting the place prepared in the event we are to open.
Yes, absolutely. And yeah, I think it is in the regulation that it does state any non-essential business that is not open is allowed to enter the facility for regular maintenance and other things. It specifies. Cindy's just behind me. Oh, Cindy found it. Just quick.
So there's a section that even if a location is closed because they haven't been designated as a location that is allowed to open, they are allowed to go in as long as they're performing specific tasks, such as allowing for inspections, maintenance, and repairs to be carried out at the place, allowing for security services, attending at the place of business temporarily to deal with critical matters or to access materials, goods, or supplies. So it doesn't mean that you're physically locked out of that location forever until they tell you can go in. It's just that if you're in there, it's just you can do little bits of work, but you're obviously not open to the public.
Correct. In terms of retail, which just, is slowly opening back up, this past Tuesday marked our first day. Obviously, things are being tried on in stores. Things potentially are now returnable depending on the policy. Is it acceptable, or what advice do you have in terms of the portion of, whatever that looks like is refunded, it's brought back by the customer what type of cleaning or airing of the garment needs to happen before it's put back on the sales floor if there's no damage to that garment?
So there's currently no recommendations for any of that. I think, again, if we think back to how transmission works, there's 3 things you can do: clean and disinfect, you can hand wash, and you cannot touch your face. You have to kind of put things into context where if you're in a store, you have to really consider all of the articles of clothing being touched. Is it realistic to have to quarantine or isolate all those objects all the time? No. But I guess if someone's returning and you know it has been maybe had a longer contact time with someone, if people wanted to isolate those items, it's not, we would never say no. Obviously, always go above and beyond to protect your consumers or what you feel is safe. But there's currently no recommendations to have to do things like that.
Perfect, thank you. So a bit more granular to that question is there a policy currently or recommendations about trying on things that would be contacted with the face, i.e. hats, not necessarily right now, but mitts and gloves in the future?
Not currently, no.
Camps, day camps, a lot of questions about that. In terms of guidelines, can they be confirmed for summer, understanding that it probably some of the option or the ability to open lies with KFL&A Health Unit?
I know that there has been a press release that says that daycares may be allowed to open in consultation with health units, but again, there have been no actual, aside from a press release, there's really nothing for us to go on at this time. Again, we're taking direction from the province, so until they actually say day camps are a go, then we're not able to approve anything one way or the other.
Okay.
I just wanted to add with that we are working with local emergency childcare settings. So we do have some resources and some experience with those types of settings already that would probably lend quite nicely to that particular sector if and when it does open up. So there should be more guidance and support coming on that.
Thank you. So there are rescue farms in the area. They do give tours. Would this still be permitted current year to date? And if so, then what would the requirements be other than the social distancing piece?
Do you mean like they can pet the animals or have rides on the animals? In what context, I guess?
I would suggest, let's just say it's a guided tour, looking, not touching.
Sure,
I don't think that would fall under anything.
It'd be like a museum, I would think, at this time. If you can't go through those types of facilities, I don't see why you would be able to go through that type of facility. And zoos are still closed as well, although they're offering drive-through service to go through some enclosures. But
I think what we're just all looking at each other is to try and think about what the current regulations say and what the current Act is saying with regards to various sectors, and it's not going to hit on every single one of them. So a facility such as what you're suggesting isn't specifically mentioned. So we would most likely liken it to something like a zoo or a museum for interpretation purposes. And as of right now, neither of those are able to operate under the requirements of the regulation for right now. But again, as Miranda was mentioning, going back to the basics about if and when they do operate, having that physical distancing, having hand washing available for individuals, shorter tours or shorter or smaller numbers of individuals gathering, those types of things could be something to anticipate. But unfortunately, just nothing just yet.
Thank you. A lot of questions about staff bathrooms or public bathrooms. Can you give us some advice on both or either?
There's no specific requirements. It's just you need to clean them at least twice daily. They're considered high touch surfaces or as needed. So when they become dirty, soiled, then they also need to be cleaned. But other than that, there's no extra requirements on having to have them cleaned specially or specifically.
Or specific disinfectants, same
Yeah.
types of disinfectants would be appropriate.
Agreed, yes.
Is that enough of feedback about that question?
I think so. I think it was just as it relates. So if you're a business owner who has washrooms that both staff and public use versus specific staff bathrooms and public bathrooms, what does the employer need to know about both or one or the other?
I think more is always going to be better if it can be worked in their operations, their daily operations to do so more than twice daily. That would be fantastic. But as of right now, the general guidance is at least twice daily or as often as needed. And again, paying really particular attention to those high touch surfaces. So the doorknobs, the faucets, the entrances into the stalls, places like that, those high touch surfaces would be if you're going to prioritize spots, then that would be where we would suggest business owners and operators would focus on.
And the other thing is too, is if they're worried about sharing of customers and staff, breaking that transmission is washing your hands. Mm-hmm. So even if it may have not been clean, the point is you will be washing your hands. And if you have to touch a doorknob after, then do some hand sanitizer after you come out of the washroom. So it doesn't necessarily mean you have to maintain that thorough cleaning constant 100 times a day, because hand washing is supposed to be your number one type of thing to break that transmission from surfaces.
So talking about furniture, if you own obviously a business and you have people coming in and using upholstered furniture in an office space or other retail or F&B location, does it require any steam cleaning? Generally, steam cleaning per day, per week. Not for aesthetics, but specific to any health regulations or advice.
I know a lot of the guidance documents do ask that if there are things that you can't clean properly, just to remove them. It's probably easiest just to remove them and have a hard surface chair that's much easier to clean regularly, because yes, the expectation is if that's a high touch surface area, you would have to clean it at least twice a day, which makes that difficult.
It's not as pretty, but it's probably a safer option for right now.
Fair enough. Should hand dryers in bathrooms be replaced by touchless or paper towel dispensers or other?
I haven't seen any recommendations for that. I think the best idea is that people are actually washing their hands, so they should be clean when they're touching it. Mm-hmm. But obviously, again, like the general public and having knowledge to know that if you're touching surfaces, you really need to hand sanitize or wash after, or use an elbow, something like that. But if that's something people want to progress to, we're never going to say no. Absolutely, it's best case scenario. Doesn't mean everyone has to revert to that.
Okay. There is locally there is a community center with several business tenants, as often there are. Is there something that owner should be doing as it relates to the center? So legally or best practice in terms of what KFL&A recommends?
Is it, sorry, it's like a community center or a built like an apartment building?
Community center, and it probably will speak to or touch upon that HVAC issue that we've had a lot of questions or fielded a lot of questions about. Is it necessary to clean your HVAC system? So you're having a lot of folks in a main structural building, but different businesses throughout. They can be intersecting at public washrooms or staff bathrooms, as well as the HVAC circulation system. So anything there you can speak to would be helpful.
So definitely maintain your HVAC, just normally change filters regularly, but above and beyond that, there's no recommendation, but you do want good ventilation for sure. Ventilation definitely helps decrease transmission. Transmission when you're outside is very low. So if you increase ventilation inside, it will decrease that ability to transmit, but there's no above and beyond other than regular maintenance of HVAC that's required at this point, because it is not airborne, it is respiratory droplets. So it's actual droplets that come out. Sometimes they may suspend in the air, but it's not, the ones that are heavier will go down pretty quick. And anything that's left doesn't last very long. So it is not airborne. It will not go through HVAC systems enough to the point that you will get sick at this point. Current information tells us.
And I think just further to that, if it's a shared location, just keeping in mind to try and decrease the number of people, say, entering the washroom like if it's a facility that's for more than one individual, just trying to be cautious of the number of people entering that small space at a time. So, you know, perhaps a sign up that says no more than 2 individuals at a time or something, something to that effect. And I think with regards to the HVAC, what ventilation does is it, as Miranda said, this is not an airborne virus, but increased ventilation will help to dry out the virus if it is left on any of the surfaces within the indoor environment. So that helps to decrease transmission risk. So just adding that as an additional note. I hope that's enough. And if there are, again, it's hard to address like specific questions in the larger scenario. So if there are any follow-up questions about that, again, our contact information about the IPAC line would be happy to get into more of the details about that particular environment.
Thank you. There are, in KFL&A, there are, of course, many outdoor attraction owners that want to welcome in guests as it relates to single-use canoes, single-use kayaks, single-use boats, single-use bicycles. So can you give some advice to folks that own those types of attractions? Because they are, we think, potentially blanketed in this phase 1 opening with independent recreation activities. So could you speak to that?
So this is with single-use
kayaks, canoes.
Yeah, it's difficult because we do have to filter through the regulations each time with like the very specific questions. Just off the top of my head and at a glance, I don't think that they are captured by what's allowed at this time. But that's certainly a question we can look further into. If they want to send a question through our COVID complaint line, that'll get back to me anyways.
Yeah. Or I guess even if it were to be allowed, I guess maybe just discuss what types of preventative measures might be appropriate, such as the disinfecting of the surfaces in between users.
Yeah.
Like
so at this time, like currently, I can't speak to I can't speak to whether it is allowed or not under the current regulations, but the expectation would be that if there is somebody that is taking something like a canoe out and bringing it back, that they have a method of cleaning and disinfecting it in between customers at a minimum.
Okay. And so would this business be required to get clearance prior to opening, or could they, as long as they sort of satisfy the cleaning procedures, open tomorrow?
They don't have to get explicit approval from us, but they would need to go through the regulations themselves and be able to, if asked, say, yes, I fall under this section because of these reasons. And they would have to actually be able to make a pretty good argument for that, because some of the wording in the regulations is very vague and kind of tricky to read. So they would just have to be able to say under that specific regulation that they do fall under that. So therefore they do meet the opening allowance.
Okay. What information does KFL&A want from seasonal campgrounds as it relates to having fulfilled the checklist prior to opening?
I'm not familiar with what checklist they're referring to. So with regards to the seasonal campgrounds, the expectation is that, I think again, had been mentioned earlier, that for an individual whose primary residence while in Canada is at a campground site, or for someone who has a seasonal contract with a campground, and that campground is able to provide all amenities, water, sewage, things like to that effect, they are allowed to frequent that location. Other than those, which is again set out by the provincial government, other than those requirements, the only other thing that we would be expecting is the regular old, safe water component. So if a campground is operating under those requirements, we want to ensure that they're providing safe and potable water to the public. And there are requirements that each of those operators should be aware of about how often they have to sample their water. And if they are uncertain of that, then they can check in with us, but that would be under the regular small drinking water system regulation. That would be similar year over year. So there would be no change in that regard. So I apologize that I'm not sure of which checklist that they're referring to.
Thank you. So I know that we're, about 3 minutes to the hour. The last question that was really repetitive, obviously restaurants are a huge part of our economy, and they're currently doing, most are trying to do a to-go scenario, which has been well received by the community. But looking at patio openings or looking at internal openings within the footprint, what's the best piece of advice you have so that these folks aren't caught flat-footed? Because essentially we know that, it's an expense in and of itself to try to protect staff, to try to protect the employer, and then to get the physical space open. So understanding we don't know when the province is going to make announcements, we get that. What's the best piece of advice that a restaurant owner can have being proactive right now?
Physical distancing is here to stay. So if you can't maintain 2 meters between people, then it's looking into physical barriers if that's something that's going to work. Again, this is going to be a long-term thing. So investing in those types of things is probably not a bad idea. Again, masks can be used, but that's as a last resort if physical distancing is a challenge, but it should be met in other ways other than masks if possible. That would be my thing, is invest, because it's going to be a while for sure.
And then the only thing I would suggest would be having a process in place to be able to, for staff to be able to identify if and when they're feeling unwell, pardon me, so that they know the system in place, the expectations. If they're not feeling well, that they should not be reporting to work, and how they go about reporting that information. So having those types of HR even channels set up in advance would probably be a good use of time too for planning. I think.
And I know people are always asking about screening customers coming in. Mm-hmm. Yes. I mean, there's no requirement, but that's always a good thing to do. You don't want someone symptomatic coming into your facility. So again, even if it's just a sign saying, if you have these symptoms, do not enter, those things are really important as well.
So we're at 2 o'clock. A few pieces of takeaway. Number one, I'm sorry about all our technical glitches, but we got through it. Thank you to KFL&A. Thank you to you 3 ladies for supporting us through this conversation. We had, well over 300 people attend our Zoom GoToMeeting/YouTube webinar. So that was fantastic. Thanks for rolling through the punches with people that may have been on other platforms and got onto this one. I will provide and share with all partners the PowerPoint, if that's okay, by KFL&A. Thank you. So we'll share that for people that chimed in late or just want that as a good resource. As well, I know a lot of partners, Kingston Chamber of Commerce, DBIA, KEDCO, Tourism Kingston, Kingston Accommodation partners, we all have COVID resource pages on our websites that directly link back to KFL&A as it relates to current and up-to-date policy. And then I will work, if there is a lot of feedback, which there has been already, then we can perhaps facilitate once another provincial sort of phase is launched or allowed in the community and there are more questions, maybe we could ask for another webinar. Considering there was over 300 people on this one, it seems that you've been able to hit on a lot of different points and a lot of different resources. I think people are now a bit more confident. So thank you to the participants. Thanks to our KFL&A partners. Thanks to Ian for getting us through these technical issues. And I want to just wish everybody a safe day. And thanks for all the participation. Have a good day.
Thank you, everyone.